Hello there and welcome back. Here we are on Module 2 Training 3. Here we are going to focus on advanced practice skills. My name is Dr. Lopez and let's find out all we need to know to ace the PMHNP board certification. So we are going to discuss here a simple concept, but which is very true to the nursing diagnosis, right? The clinical presentations on nursing therapeutic relationship. And this is really has Papalau really all over the place because Papalau says, Dr. Papalau, it's is it discusses the theory of interpersonal relationships between the nurse being a therapeutic tool, a conduit to improve the person and not the diagnosis. We focus on the people, on the patient, not on the diagnosis, right? So that's the interpersonal relationship that the doctor Hildegard Paplau had mentioned or theorized um, for us today to being able to conduct a holistic approach in nursing therapeutic relationship. So, what is it? It's importance of the therapeutic relationships in nursing and healthcare. Patient needs and goals. Therapeutic relationship, Papalau, is focused on the patient needs and goals, not the diagnosis, enhancing the patient care and well-being through effective communication, right? Very important. So the therapeutic relationship is a mutual, interactive, interpersonal relationship, right? Between the patient and the nurse. A focus on the patient's identified needs, not the patient's diagnosis, is a patient-centered approach, needs and goals oriented, which promotes the patient engagement and satisfaction. What else does it bring to the table? Well, it uses the components of genuineness, which is being open, honest, transparent in the interaction. For example, nurse admitting they need more information to better answer patient questions, right? You being genuine. An example two, here we have acceptance, which is recognize each individual unique experience, belief, culture, and background. Which you really think about this. This is remarkable because it was back in a day when we did not quite accept everyone's uniqueness, experience, beliefs, culture, and background, right? So Dr. Papalau, she put out this therapeutic relationship during hard times. And one example here of acceptance is the nursing accepting the patient's religious view on medical treatment. Non-judgmental attitude is removing bias, prejudice, and personal opinions from the clinical interaction. Example, nursing providing care to a substance abuse patient with respect without judgment. What are the components? We have to be authentic or authenticity, creating trust by being genuine, honest, and maintaining professional boundary. Work with empathy, demonstrating understanding of the patient's feelings and emotions without imposing personal beliefs or emotions. Right? For example, a nurse acknowledges the pain of the grieving family members while providing comfort. We act with respect, valuing the dignity, autonomy, and individuality of each patient, regardless of the background. Example, nurse requesting consent from the patient before performing any procedures. That would be respect in this case, right? So all these components, they're important because it's part of the interpersonal relationship that we develop. Now, one of a very well-known high-yield concept here is transfer and counter transfer, which is very, very simple. When we talked about transfer, is the patient transferring on to us their feelings. For example, let's say that the patient is angry at the therapist because he reminds her of someone that sexually abused her during childhood, right? So every time the patient sees the therapist, she becomes angry. The countertransfer is the therapist acting on the patient. For example, let's say that I am the therapist and I have an older lady, and the older lady reminds me of my grandma, right? This is just an example. Let's say my grandma back in the day beat me up all the time. So I became angry at it. So every time I see a patient, I would display incongruency that I would not do with other patients, right? Because the patient reminds me of my grammar back in the day. That's just an example, okay? So let's go on. So transfer, the patient displays some feelings of significant person or people from their past onto the healthcare providers. Counter transfer is the healthcare provider transferring their feelings or emotions to a patient, so to patients, right? Now, how do you counter counter transfer? Well, you could ask a colleague to be in a room with you. You could ask a colleague for assistance in this case, right? Because it's something that's within you and you have to overcome if it's affecting the patient relationship. So asking for assistance, it's totally okay. Communication or therapeutic communication is a two-way exchange that focuses on the patient's beliefs and goal and not the diagnosis. It collaborate effectively, promote healthy physiological well-being of the client, and this client-centered relationship, trust and respect. Okay. And that's it. Let's go on to the next training video. My name is Dr. Lopez, and I can't wait to see you become board certified. Bye bye.